Well, the doctor is in, and today it's Pediatrician Doctor Courtney Sauls from Ascension St. John Pediatric in Adolescent Medicine. And today she's here to talk about purple crying in infants. Dr. Sauls, good to see you.
Hi.
We're talking about purple crying. So this used to be called a different name, right? What was it?
Yeah, so it used to be called colic. Colic was kind of those weird things where it seemed like a diagnosis, something was wrong with your baby. And now we understand infant crying a bit better. And so we have this acronym called purple crying, which is used to describe this type of crying in infants.
Gotcha. So what is it?
Yeah, so the P in purple stands for peak. So babies have this kind of peak crying episodes up to 2 months of age. Then it starts to come down by 3 to 4 months. The U is for unexpected. The crying might come up out of nowhere. It may not have been provoked by anything. And then the R stands for resist soothing. So all the efforts that you try may not even work to help your baby to stop crying. And then the second P, they may make a pain-like face when they're crying. Then the L is that it's long lasting. Babies can cry for several hours at a time, which can be exhausting to new parents. And then the E is for evening, that the crying mostly happens at night in the evening hours.
Any idea what causes this? I mean, for a new parent, this is probably really scary because you think that your baby's crying nonstop and, but you want people to know it is normal.
Yeah, exactly. So I see a lot of parents in the clinic that come, my baby is just crying and so upset. This is a very normal social developmental period for infants, but can also be very frustrating for parents. It's important to know that there are ways that they can learn to soothe their babies. So good ways to soothe an infant that's crying and really upset is holding them, rocking with them, walking at kind of a rhythmic pace, baby wearing with the sling, even pacifiers are great, singing or talking to your baby in like a soothe, calming manner. Those are all tips that you can start when a baby is first born, and then they will learn that they'll adapt to those soothing mechanisms to help lessen the crying. It may not work all the time, and that's okay, and it will get better as the baby gets older.
Is there a time when a parent should be worried? Maybe a baby just cries nonstop. When should a parent be worried, and maybe when should they contact their pediatrician?
Great question. So if your baby has a fever at all above 100.4 and they're an infant, that's an emergency. Your baby is not eating well. It seems crying all the time. With this kind of purple crying, it's common for it to be really frustrated certain periods of the day, but they shouldn't be like that all the time. They should have periods of good wakefulness where they might be cooing or smiling or happy. If they're not doing that, that's concerning. Or if they have a lot of vomiting, their belly seems really tight, those are all good times to come see your pediatrician. Or if you're just worried, we're happy to see you anyway. That's totally fine.
And do they grow out of this? You mentioned that this is common in infants, maybe newborns, but when do they kind of grow out of this period?
Yeah, good news is they do grow out of it, some at a little faster pace than others. So if you are one of those parents that has a baby that is just crying so much, it might last a little longer, but it will get better. The peak is usually around 6 to 8 weeks, but by 4 months of age, usually it's much better.
All right, great advice. I know it is scary for new parents especially.
Absolutely.
So great advice as well. So if you have a question for today's doctor or any of the doctors that we have here on the Noon Show, you can email them to us at noonshow@griffin.news or go to our Facebook page.